Spots on your nails and its connection to zinc, a personal story. Hi there, my name is Dr. Walter Lemo, naturopathic physician with a practice solely focused in cancer care for over 20 years. I was recently talking to a patient and we were discussing about minerals and deficiencies, and it sparked a conversation. So, when I was a younger naturopathic medical student down in Seattle, I was sitting in the cafeteria and I was talking to my professor, Dr. Alan Gaby, who's considered like the modern day father of nutritional medicine. So, as an example, here's this huge book that he's devoted his life to, super thick, a lot of information in there. And so he was looking at my nails and he goes, "Oh, you have those white spots." "Yeah, the zinc spots." And I said, "Well, why do you call them zinc spots?" He goes, "Well, when you take zinc, they can go away." So anyways, being a younger, curious student, I was like, okay, I started to supplement with zinc. And sure enough, what I started to notice as the nail was growing, there was no more spots. So in essence, those white spots were moving further and further up and away, which I thought that was really cool. But guess what also happened? So several years prior to that, I actually injured my big toenail playing soccer, and it fell off and it never grew back. It was that way for years. And so all of a sudden, guess what I started to notice on my toenail? Nails started growing back. And it grew back normal, like no discoloration, no denting, no nothing. And here people were telling me, that nail's never going to grow back. You damaged your nail bed, blah, blah, blah. And so it was kind of an interesting reminder for me, is that the body is programmed to heal. It wants to regenerate, but sometimes when there's missing pieces, it just can't do it optimally. So it wasn't like I had any obvious underlying issues. I was in my mid to late 20s. I was pretty fit. Otherwise, sure, some stress from school and other things, but so it was a reminder for me that, I had some so low level of the zinc deficiency that, otherwise my body was operating well. And by providing it with zinc, it corrected itself. And then the body just started to use what it needs. The only thing with zinc that I've kind of learned in our experience is that the body is quite wise. So I've learned that if you take too much of it over time, you can start getting upset stomach, diarrhea, indigestion. And I think it's just the body saying, I have too much of it, and it's just trying to expel it. Like, don't give me any more, or lower the dose. But something as simple as zinc was a teacher for me of all potential underlying nutritional deficiencies that people may have. It's not easy to detect these on blood tests or other kinds of testing. And sometimes there's just elements of trials and errors, or just paying attention to your body, and because it's always talking to you, telling you things that, there's signals that I find it's becoming a lost art as people become more tech, more into blood tests, more into imaging, more into, Star Trek devices. But something as simple as spots on the nail was like a signal for me of I was lower in zinc.